Thank you for the kind introduction, Madam Chairman. My presentation today is entitled Understanding and Eliminating the Stigmatisms and Myths Associated with Male Breast Cancer. Good afternoon, ladies and gentlemen. The folklore that breast cancer is a disease that only affects women and that many men diagnosed with breast cancer feel they are abnormal and have done something wrong have, over the years, contributed to the myths associated with male breast cancer. Estrogen receptor positive tumors are diagnosed in 80 to 90% of all male breast cancer patients. One major stigmatism was that up until the mid-1980s, men diagnosed with these tumors, which had metastasized or were inoperable, had their testicles removed in order to prevent further growth of the tumor, because 20% of male estrogen is produced in the testicles. This, combined with the fact that many men believed they would die from what they considered to be a woman's disease, contributed significantly to the abundance of uninformed individuals and therefore the much lower survival rates. My name is Herb Wagner, and at the age of 73, I am an 11-and-a-half-year breast cancer survivor. I am also the founder and CEO of A Man's Pink, a male breast cancer advocacy organization that supports our website, malebreastcancer.ca. Our website provides information and support to other male breast cancer patients, survivors, and their loved ones. A Man's Pink mission is to increase awareness, promote early detection, and optimize the survival rates for men diagnosed with this disease. Our goal is to establish the third week of October as Male Breast Cancer Awareness Week globally. The survival rate for men is approximately 10% lower than it is for women diagnosed with the same disease. With your support, we can expand our mission and achieve our goal of identifying the third week of October as Male Breast Cancer Awareness Week globally. Early detection saves lives. Although very rare, approximately 1% of all breast cancer is diagnosed in men. In 2015, it was estimated that about 2,350 men in the U.S., 200 men in Canada, 400 men in Australia, and 125 men in the UK will be diagnosed annually with breast cancer. As a result, approximately 450 men in the U.S., 45 men in Canada, 80 men in Australia, and 25 men in the UK will die from this disease each and every year. When diagnosed with the same type and grade of tumor at the same stage, the prognosis and treatment options for men are similar to that for women. Unfortunately, the overall prognosis for men is not as good as it is for women because more often than not, male breast cancer is diagnosed at a later, more advanced stage. Consequently, the 5-year survival rate for men is about 74% compared to about 83% for women. This is in part due to the fact that many men, and sometimes their doctors, are unaware that breast cancer is a disease that can affect them, and also because men in general are reluctant to seek medical advice, especially regarding a breast issue. Consequently, my mission has become to increase awareness, early detection, and the survival rates for men. The extensive promotional campaigns sponsored by the large breast cancer organizations and the general media pharmaceutical companies in the 1980s to increase awareness and early detection for female breast cancer have and continue to further the ever-increasing support for female breast cancer. Consequently, the survival rates dramatically improved and continues to increase as more sophisticated detection methods, combined with increased awareness and early detection, continues to lower the death rates for women diagnosed with this disease. Today, male breast cancer is riding the coattails of female breast cancer. Unfortunately, because the incident rate is so rare, male breast cancer has not experienced a similar destiny. Today, our mission has become to achieve the same survival rates for men. After being diagnosed in 2005, I struggled with the stigma of having a mastectomy and a woman's disease. The support I received from my medical team, my daughters, and my many friends in Florida was instrumental in helping me get through the difficult times following surgery. However, as a man, I found it extremely difficult to accept this outpouring of support, and only long after surgery did I realize how grateful I was and how much I needed that support to fully recover, both mentally and physically. I am sure I would not be where I am today if it were not for my dearest and best friend, Barbara Francis. Although Barbara passed away in 2007 after a lengthy battle with ovarian cancer, it was the time that I spent with her after my surgery until her passing that was responsible for creating the caring, supportive individual that I am today. Barbara truly was an amazing woman who wholeheartedly believed that individuals can have a positive impact on others during their lifetime. Following surgery, Barbara helped me realize that I was now in a position to help other men that had been diagnosed with breast cancer. Because this disease is so rare, and due to the fact that in 2005 there was very limited information available, she encouraged me to begin speaking publicly about this disease as a way to increase awareness. Following one of my talks at a local function in Tampa in 2007, I was contacted by Joanne Ranney and asked to participate in the Seek and Speak Your Story program offered at the Moffitt Cancer Center in Tampa. This course is designed to help cancer survivors in the Tampa area develop their story and find comfort in discussing their personal experience with cancer. During this course, Joanne and the other cancer survivors helped me find the courage and the inner strength to open up and discuss male breast cancer. For this, I am truly thankful, as this was the motivating factor for creating our website, And a Man's Pink. Events must align in order to develop any successful organization. Our events started to align back in 2004 when my youngest daughter Heidi enrolled in the Pathology Assistance Program at Wayne State University in Detroit, Michigan. When I was diagnosed in 2005, although I had the utmost confidence in my medical team in Florida, I was able to obtain a very valuable second opinion when all my results were forwarded to Harper Hospital in Detroit. As mentioned previously, my friendships with Barbara and Joanne were also instrumental events which provided the confidence and inspiration to continue to reach out and find new ways of increasing awareness. There was very little information on the internet when I was diagnosed in 2005. When we started to develop our website in 2008, there were 3 actual male breast cancer websites available: Out of the Shadow of Pink, the Brandon Greening Foundation, and the John W. Nick Foundation. As well, a small amount of information was available on a couple of the major breast cancer organization websites. When Heidi started her working career with MD Anderson Cancer Center in Houston, Texas, moved to Roswell Park Cancer Institute in Buffalo, New York for 6 years, and then back to MD Anderson, it provided us with an excellent resource to review the data that had been and continues to be placed on our website. To be effective, it is imperative for us to ensure all the information continues to be up to date and accurate. Since launching in July of 2009, more men each year are becoming comfortable learning and talking about their disease, telling their stories, and developing websites. There is now a vast amount of information available on the internet, including very accurate and informative postings on most of the major breast cancer organizations' websites. Progress has been made in increasing male breast cancer awareness. A Man's Pink has progressed to currently having 48 men from around the world with whom I am in constant communication with, and 13 of these men have posted their stories on our website. Since launching our website, men have become more comfortable in learning, speaking about, and living with their disease. As a result, the majority of the stigmatisms and myths are starting to disappear. For example, identification of the estrogen receptor eliminated the removal of men's testicles as a treatment option, which had so negatively impacted male breast cancer. In May of 2014, I was contacted through our website by internationally renowned Australian breast cancer oncologist and author John Boyges to comment on his book entitled Male Breast Cancer, Taking Control. The book was published in March of 2015. Since that time, we have been working closely together to find ways to promote awareness for patients to increase early detection and therefore increase survival rates. I personally met with John in San Francisco in October of 2015, at which time we discussed if and how it might be possible to focus more attention on male breast cancer to the medical community. We wondered if it would be feasible to initiate a male breast cancer session in a major breast cancer conference. We had been fostering the idea that if we could collaboratively provide a global vehicle for all those directly involved, including clinicians from all areas, patients, survivors, and advocacy organizations, we could expand our mission to have actual male breast cancer sessions included in breast cancer and oncology conferences and symposia globally. To date, our advocacy efforts to promote global awareness include presenting a poster at the European Breast Cancer Conference in Amsterdam in March of 2016, an oral presentation at this conference, our first inclusion of a male breast cancer session in the Clinical Oncology Society of Australia's conference in Australia in November of this year, and a poster presentation at the San Antonio Breast Cancer Symposium in December of this year. The 34th Annual Miami Breast Cancer and the American Society of Clinical Oncology Extended Education Session Conference Program Committees are currently reviewing our proposal to include a male breast cancer session in their 2017 conferences, as is the 11th European Breast Cancer Conference Committee to include a session in their biannual 2018 conference. Although men are making headway in improving awareness, early detection is increasing, and the survival rates for men are starting to improve, we must continue to promote increased awareness in order to reach more and more men, as well as the medical communities globally. Eventually, we will achieve survival rates similar to those for women diagnosed with breast cancer. While we continue to offer treatments for men based upon female breast cancer protocols, recent studies are starting to show that differences between male and female breast cancer are becoming evident. For example, recent BRCA1, BRCA2 mutations studies by Professor Charlene Hesbiber of Boston College indicate that men who are positive for BRCA are more likely to get tested to learn about their family's risk rather than their own personal health, are less likely to perceive a positive BRCA test result as a direct threat to their health, and are less likely to undergo medical procedures to reduce their risk. The The primary goal of the Male Breast Cancer International Program, initiated in 2013, was to analyze the largest series of male breast cancer cases ever studied, involving 1,822 men treated between 1990 and 2010. Results published in 2014 showed new insight into the clinical and biologic characteristic differences of breast cancer in men and those previously reported for breast cancer in women. The results also indicated that men diagnosed with breast cancer are not well managed in the clinic. For example, even though most male breast cancers are estrogen receptor positive, only 77% of those patients received endocrine therapy like tamoxifen. There is ongoing debate about whether aromatase inhibitors used in females are as beneficial and effective in men. It was also reported that even though 56% of male breast cancers are diagnosed when the tumors are very small, only 4% of those patients had breast-conserving surgery. Most underwent a mastectomy, which significantly impacted their quality of life. In this study, 92% of the tumors were positive for the estrogen receptor. In the future, we hope that these results will provide better treatment options for men. Increasing awareness is starting to provide opportunities for men to identify and overcome the difficulties male patients encounter in terms of lack of support and being treated with female treatments in a female environment. By increasing knowledge, we can eliminate the stigmatisms and myths and provide men with a more comfortable setting in which to endure their treatment and recovery. Since 2009, we have been gaining momentum, increasing awareness, and survival rates. The next natural progression would be for male breast cancer advocacy organizations to push the medical community globally to include more men in the breast cancer clinical trials. Our goal is to provide the best possible treatment and outcome for male patients. Consequently, we are continually seeking input from medical professionals and organizations as to what they feel should be done and how to best accomplish our goals of improving awareness, early detection, and increasing the survival rates for men. As a result, we have put together a survey in hard copy, which is available here today and is also available on our website. We would appreciate any comments and suggestions that you can put forward to improve the quality and treatment options and outcome for men. In conclusion, we've added some blue to the sea of pink to ensure that all men will pause and think. Breast cancer is a disease that affects men too, and that's why we've added the blue. Breast cancer awareness and breast self-exam are not just for a woman, but also for a man. A man's pink teaches us to pause and think, and that's why we've added the blue. To increase survivor rates, we're striving to proclaim the third week of October as Awareness Week for men. Increasing awareness allows us to survive, and that, ladies and gentlemen, is why we've added the blue. Thank you so much for your attention, ladies and gentlemen.